And welcome back to the first segment of this morning's show. As we mentioned prior to the commercial break, we are going to be joined and have been joined on set by representatives of the National Drug Abuse Control Council and the Belize Cancer Society. We have with us Madame Laura Longsworth. She is the president of the Belize Cancer Society, and Esner Vellos. He's the executive director at the NDACC. Good morning, ladies and gentlemen.
Good morning.
And thank you for being here.
It's a pleasure. We're getting closer to the end of Cancer Awareness Month.
That's right. So obviously this activity that will be held in commemoration of World No Tobacco Day is going to tie into the very end of Cancer Awareness Month. Before we speak about that, I just kind of want to do a summary of the efforts that the Cancer Society undertook to be able to help to spread the message about healthy lifestyle and, of course, prevention for cancer.
Yes, the Cancer Society has that responsibility of raising awareness, and we have taken on the responsibility, really moving ahead in all areas, utilizing the approach of managing non-communicable diseases across the board: diabetes, asthma, cancer, hypertension, have some modifiable risk factors that affect you across the board. Some of them would be like tobacco, alcohol, fats, sugar, sedentary lifestyle. Those issues affect all diseases across the board. Additionally, we've been really trying to get citizens and our communities and even our authorities to remind us all that NCDs cost money. It's costing the country a lot of money. And you just have to walk down the street and see our people with strokes and diabetes and so on. And so we are still rapping on doors. I don't think that we're getting the kind of impact that we need to have. But then again, it's just one organization. I think that the Cancer Society has to rethink its strategy. We probably need to team up with bigger organizations. We have teamed up with Social Security Board for the HPV vaccine. We want to be able to team up with insurance companies for NCD awareness. And so we're proud that Atlantic Insurance really is a sponsor for the commemoration of the whole issue of the World No Tobacco Day on Wednesday. And so the Cancer Society had events over the Cancer Month. We had walks in Dangriga, we had in Toledo, Belmopan, and of course our big walk on Saturday. We also had an amazing Cancer Challenge ride. It's the second one, and that one is to raise awareness of prostate cancer. And this year it was another successful event. So we're looking to better marketing of these events, maybe to our Belizeans abroad, to see if we can get even more support, even financially, from them. The method of fundraising is inadequate. I think we have to do more grant writing and so on to make sure that we continue to sustain the level of campaigns and awareness that we do. And so when we realized that World No Tobacco was on May 31st, we thought what better way than to team up with NDACC, and they're the big cheese, the big people, and the whole issue of tobacco.
One of the messages that has clearly shifted when we speak about cancer is the inclusion of cancer as one element of what we can call a mass campaign against NCDs.
Yes.
Why is that? And this is for both organizations. Why is it that, or is it perhaps a matter of being able to address the general risk factors for all the non-communicable diseases? And we talk diabetes, hypertension, cancer, obesity. Yes. Those are the main ones I know.
Yes, but all those factors lead to one thing: healthy lifestyle, wellness approach. And if you, for instance, start with nutrition, And we start with optimal nutrition is breastfeeding. And so if we get back to optimal nutrition, there are protective factors in there on the long run, even against certain kinds of cancers in older years. And as our children grow and their nutrition changes, then we get into trouble. We've got to make sure that they keep fit. They have sort of schools in London, for instance, when they have their breaks, they go on short runs.
Yeah.
You know, they go on short runs because it's important to keep them moving and to give them that overall feeling of well-being, so they don't think so much about the pizzas and so on, eliminating pizza and all those things from their meals, but adding other healthy things, or using healthy pizzas, vegetable pizzas and stuff like that across the board. And so then you will get into the whole issue of prevention of these other things, health education on the bad effects of tobacco, bad effects of alcohol. So it's, you know, we have to get back to basic things, and that the community can be involved. It's empowering the community to stay healthy. NCDs cost big bucks to treat. Right, Esner?
No,
and on a personal level and as a country.
Absolutely.
Esner, in terms of tobacco consumption, what are we looking at in Belize in terms of the breakdown? The men, women, young children, youth, etc.
The National Drug Abuse Control Council partners with the Pan American Health Organization every 2 years to do a global tobacco survey. And that tobacco survey gives us an idea of where we are and what is it that we need to do so that we can address not only the issue of reducing the consumption of tobacco, but also proposing legislation to the government so that we can safeguard the good health and the moral well-being of our people. Our most recent survey was done in 2014. We are up this year to do a follow-up survey. And in that 2014 survey, we noticed that approximately 12% of our population consumes any type of tobacco product. One of the things that we saw was that there was an increase in terms of the younger population consuming tobacco, and that for us at the National Drug Abuse Control Council is our most targeted population because they are the future of our country. So we have to make sure that the message of reducing the consumption is given to them at an early age. Hence the reason why we at the National Drug Abuse Control Council have designed programs and intervention packages that would not only deal with youths, but also from the preschool level up until tertiary level education. But one of the things that 2014 statistics showed us was that there has been introduction, if I should say, of smokeless cigarettes, ends and so forth. It's at 2%, but it's at 2% that if we do not take care of it right now, it can increase drastically right in front of us. Hence the reason why the Ministry of Health through the National Drug Abuse Control Council have been pushing the agenda of legislation, not only in terms of for the reduction of the demand of tobacco, but also in terms of the regulation of the sale of tobacco, also to making sure that there is effective labeling so that the message that tobacco consumption does cause harm to your body is spread out throughout the country, but also in terms of legislating in the area of taxation, because it has been proven that an increase in tax on tobacco can deter the consumption of tobacco among our people.
Hurt the pocket first, right?
Yes.
Let me put a straightforward question here. When you look at tobacco consumption, nicotine, and you look at alcohol consumption and marijuana, it would seem apparent that among our young population, those three substances, if I may, the use of it has spiked considerably over the past couple of years. I look around, a lot more young people are drinking, smoking, and smoking weed, and doing any other form of recreational drug. But these are three big businesses, if I may. When you look at the economy of marijuana, you look at the economy of alcohol and other spirits, and you look at the economy of nicotine and tobacco, you're fighting what many would want to see a losing battle, because while you're saying, yes, there's a World No Tobacco Day, so many cigarettes are coming into the country that are being sold legally and illegally. So how do you offset, how do you try to find some medium where you know that your message is being delivered?
It's a difficult task, but a task that can be done with effective legislation. Hence the reason why, I repeat again, the Ministry of Health has been pushing very much to make sure that we would be able to have a national tobacco bill and also a national alcohol policy, specifically in the tobacco legislation, because in the country we might have cabinet papers that would deter the consumption of tobacco in public spaces, in government buildings and so forth. But we need that legislation so that there could be penalties for institutions or individuals that would smoke in areas that are not allowed. We're also looking in terms of taxation. It's very important that you said it right, it's a big industry and a taxable industry that can, in one way or the other, we can use those taxes to develop not only research but also push the agenda of more information to the general public.
Now, the challenge with this issue, and I think perhaps that's the part that we don't get to talk about as often, there is, of course, the legislative changes and the taxation. In other words, deterring the incentive to start or to purchase because it becomes too expensive. Or if you smoke in a public area, you have penalties to face. But unlike perhaps how we eat, I mean, there's some new research with eating, this is an addictive behavior. Tobacco, alcohol, even marijuana, there's a psychological connection as to why people use. So even when it becomes expensive, you'll still probably have people purchasing if they have that addiction. So what is being done in terms of supplementary programs to ensure that if somebody says, you know what, World No Tobacco Day, I'm ready to stop for health reasons, because I want that money to go back to my family, whatever it is. What is being done to help in that area?
Belize is a signatory of the Framework Convention on Tobacco Control. And the fact that we are part of that worldwide treaty, there are some obligations that we have. And part of those obligations, even though that as a country we do not have the tobacco legislation as yet, we're still moving the agenda forward. In reference to what is it that we're doing, through the Ministry of Health and the psychiatric unit of the Ministry of Health, we have made sure that we include all types of addiction within the mainstream public health system, whereby in terms of alcohol or any other substance, individuals can go through the primary health care services and be provided with detoxification services, cessation programs and so forth. And that is a big milestone, because whereas the National Drug Abuse Control Council was the entity back then for outreach services, now by incorporating the mainstream health system, then our people will be able to have access to more and affordable care for substance abuse.
Now, the obvious link here when we're talking cancer and tobacco is lung cancer. What are our current statistics showing in terms of persons who are affected by this specific form of cancer?
And lung cancer is among one of those cancers, because according to the Ministry of Health, you have cervical cancer and breast, and uterine cancers, and for men you have prostate and so on. But coming right under those cancers are lung and colon cancers.
And it's lung, esophagus,
and
mouth.
And lots of people don't realize that tobacco influences cancers that they don't think about. There's a link with tobacco and cervical cancer. There's a link with tobacco and asthma. There's a link with tobacco and chronic obstructive pulmonary disease, and heart disease, tobacco and heart disease, tobacco and cardiovascular disease. I mean, it's crazy stuff when you look at it, and you might just be that one that your system reacts to the tobacco and you start losing limbs. So it's very, very. I mean, oral cancers, throat cancers. So it's tobacco. We need to sit up and take notice.
Yeah.
And we have to get our kids to understand those
Let
stats.
let me ask you this. Is it that we are fully aware of what the side effects of tobacco consumption are, and we're simply playing it a blind eye? Because
Well, the Ministry of Health prints cautions on all the on all the boxes.
I think it goes beyond that.
Yeah.
As a television viewer, I have seen all these truth commercials from the time I was in high school. You're seeing these commercials where it shows you the real life effect of cigarette smoking on people. People lose limbs, people lose teeth, people have cancer and all of that. And maybe it deters me from smoking because I saw the ads and I realized, you know, that I don't want that to happen to me down the road. But then you have other people who are also very much aware of what the consequences are. But I guess it's either because they're addicted or they really don't care because it's the cool thing to do.
We're talking about behaviors.
Yeah.
And you're taking we're also speaking about our own health belief, what we believe about health, and whether we believe we can get sick or not. Some people think that you will get it and not me. And so I always say, regardless of whatever fancy we do, it comes down to the individual. And it comes down to the change in behavior. And we're having the same conversation at the National AIDS Commission. It's the whole issue of people taking personal responsibility for health. And we think that while we're talking to the adults, we need to make sure that we put things in place for our youngsters, put stronger regulations in place for to make it more difficult for them, and to pay attention to worldwide statistics. There are countries with great data that can show you. Mexico, for instance, they're having amazing results with reduction of sugar drinks. They're doing amazing work with that, and they have the data to show it, and they work with their own communities.
Yeah.
And other countries can show you great results with tobacco reduction.
Yeah.
I went to a meeting to represent Parliament, and I sat in a room with some parliamentarians, and this gentleman was from New Zealand, and I said to him, look, how do they're having everything, they have the packaging right, everything. How did you do that? Because I mean, this is a business, and the tobacco people are big lobbyists and so on, and it's their business, it's money. It's money for everybody. It's money that comes into the country's coffers, it's money. And he said, yes, but all the members of their parliament saw that as a health issue for development, for their nation, for the cost, the great cost that it's imposing on the people. And so the theme actually was so appropriate because for this year, because it's against
tobacco threats development.
It threatens development, and indeed it does because of the cost to health and cost to.
I believe it was
economic
last year or the year before the WHO kicked off a campaign with what they call the ugliest color in the world as what should be the generalized packaging for tobacco products, because essentially they believe that part of the attraction and a sales pitch is how the cigarettes are packaged. We haven't seen that. I've seen it in other countries, but I haven't seen it in Belize as yet. How is that? And do you feel that that will be part of the deterrent here?
It's part of an ongoing process.
Okay.
The Caribbean regions are working together through CrossQ, so that as a region we will be able to address the issue of marketing, labeling, and making sure that the content in these packages would be something that our Caribbean people will be able to understand and so forth, right? But what is important here to say is also that the idea of the team and how much it affects the people of our country. Everything that we do in life has a link, right? And even when you consume tobacco, many times you would say, but I am the only one that is consuming it, so I'm the only one that is being affected, but not necessarily, because there is the whole agenda also of secondhand smoking, and there are times where more people are affected by secondhand smoking, and the economic cost of addressing secondhand smoking is far more greater than addressing the direct cause, right? So it is very important that when we are looking at legislation, that we make sure that we cover everything that needs to be covered, so that we will be able to reduce the like they say, the prognosis of making sure that everything that is being done and provided to our country, that it would address the social impact, the economic impact, the health impact, so that we will be able to, in one way or the other, safeguard the good health of the people of Belize.
We get calls all the time asking about smoking in restaurants, in hotels, and so on, and because people have severe allergies to just the smoke. They can walk into a room where there was a smoker, and immediately their throat. So we have to make people know these things.
Do we have regulations? What are the current regulations about indoor smoking?
In 2010, the government of Belize, through the Ministry of Health, presented a cabinet paper that was in line with the Article 8 of the Framework Convention on Tobacco Control, that looks at protecting our people from secondhand smoking. That cabinet paper was approved by the cabinet members, whereby a number of areas were designated as smoke-free areas. For example, public spaces, all government buildings are smoke-free. All health institutions are smoke-free. All schools should be smoke-free, and some restaurants and public spaces. Right. I believe that in that specific cabinet paper, the only areas that were not included were bars and casinos. Right. But even though that cabinet paper is there, and it is helping a lot in terms of sending the message across, we do need that legislation to back it up, so that whenever these areas are infringed, there are certain level of penalties that would be occurred to the individuals who do that.
Need to speed up that legislation. I can't wait.
Well,
so that I can tell
I could
so that I can look down and see it being passed.
I could say that as it is right now, the legislation is being reviewed by the Attorney General's ministry. So we are quite a step ahead from where we were a couple of years ago. So we're looking forward to making sure that once that is done, that we will put the legislation for consultation, so that the people know what is happening and what will be in the legislation, so that at the end of the day we will be able to safeguard the good health of our people.
Let's hope the AG is listening and push it through.
Yes.
So let's talk about how World No Tobacco Day will be commemorated in Belize this year. It's a joint venture.
Yes, it's a joint venture, and Heather at the office, she's always thinking these things, and we're also signing on to the American Cancer Society for Prevent 20 thing that you can do different things. So she said, okay, we'll do a health fair. So they got all those agencies that are affected, Diabetes Association, and other agencies. We're even doing pap smears, pap campaigns there as well. And of course we have our partners from NDACC, who will be sharing the technical information on tobacco smoke, and the dangers of tobacco smoke. And of course we have the our sponsor will be there talking about their cancer plan that they have.
So they're introducing, this I find interesting, they're introducing a cancer insurance policy. So once you have been diagnosed, you can tap into it. And
so they're apparently that they're going to be talking about it to people and have people look at it. And I think that's a good thing. We need to start planning for our future. And so it's very important. So we thank all the organizations who are joining us today. It should be exciting on Wednesday. Should be exciting with Esner from NDACC, and we thank you for partnering with us. And I think that we have to make this bigger, even bigger next year.
For us, it's a welcome partnership. It's part of our commitment at the National Drug Abuse Control Council to work with more agencies. And what better with Cancer Society, who is one of those one of the NGOs that can mobilize a lot of people.
Yeah.
And if we at the National Drug Abuse Control Council want to push the agenda of tobacco forward, we have to make sure that we take into consideration the effects that tobacco causes in terms of cancer and so forth. And basically for us, it's what we have traditionally had at our central office at Amara Avenue. We're going to transport it to the Mercy Lane headquarters of the Cancer Society so that we can send the message across.
Okay, fantastic. Right? Anything else you'd like to say in terms of reiterating the message of World No Tobacco Day?
Well, first of all, I invite the general public to attend our exposition that we'll be having at the headquarters of the Cancer Society. But more important also is to send a message across to our young people and to the general public that you get the facts, get the information that you need, make decisive decisions that would change your life and change your lifestyle. At the end of the day, tobacco does kill, and it kills as faster than what you might think of.
And then, I just want to take this opportunity to say thank you to the media, your station, who especially have been, Sunny, I saw the clip on the Cancer Walk and I was like, he does that for us every year. We really thank you for that wonderful support. And all the other agencies, everybody who has really helped us to make the Cancer Awareness Month a very, very, very exciting month for us. And we keep going from strength to strength. I don't know, sometimes we don't know where the money will come from, but it comes. And so we get it done. And we like to think that people consider us some little corner that they can get the right information about any one of their NCDs that they have, because we navigate them towards the direction that they need to go.
I also like to take the opportunity to thank the Pan American Health Organization. They have been very, very instrumental in making sure that the agenda of tobacco is a topic being discussed here in the country of Belize. So the Pan American Health Organization has not only provided us with capacity building for institutional strengthening in this area, but also all the support in making sure that we every year have a World No Tobacco Day activity in the country.
Well, thank you too. And of course, the actual health fair takes place on Wednesday here at the Belize Cancer Society compound. And what time does it start?
It starts at 9 and it runs up until 3:30.
And so you can get
HIV testing, pap smears, diabetes, that you can get
sugar test, blood pressure test.
Just come in. Just come in and see what is there.
Definitely.
Yes.
So that's on Wednesday on the official World No Tobacco Day. Do check it out. Thank you for joining us this morning. We're going to go ahead and take a break, and when we come back, we'll be talking about the 9th Annual Flowers Bank Festival. That's coming up after the break, so stay tuned.